Welcome to Marian Ayurveda. In this episode, we are going to discuss the condition known as hyperactivity in children. To some extent, all of us are familiar with this. What is hyperactivity? Its name is Attention Deficit Hyperactivity Disorder, or ADHD for short. Attention deficit, that is, being unable to pay attention along with having hyperactive behaviors. This is generally the biggest problem faced by children in schools. For parents and for teachers as well, the biggest complaint they have is about this hyperactivity disorder. My son doesn't sit still, or he can't concentrate while studying, or as mothers often complain, when they sit down to teach their child, within a minute the child gets up and walks away. There are many things like attention or the inability to pay attention that people talk about. I am going to talk about how Ayurveda can treat this and what kinds of treatments are available in Ayurveda for this issue. I am Dr. Anumod Kakkassery Marian Ayurveda Thrissur. First of all, to some extent, we know what this disease is. Let us think about the cause of this. Why might this be happening? I feel that starting from pregnancy itself, there are significant possibilities for this if we speak from an Ayurvedic perspective. Any tensions or stressful factors that the mother experiences during pregnancy can affect the baby as well. Similarly, the mother's eating habits also play a role. For any hyperactivity disorder to develop, it usually happens when there is an increase in spicy and sour foods in the diet. That's when a hyperactive disorder can occur, because we see results only when we give medicines that counteract this. So when spicy and sour foods are increased, even if it's in the current situation, it is observed that this disorder worsens as the intake of spicy and sour foods increases. So for that very reason, if the mother has consumed a lot of spicy and sour foods during the pregnancy period, there is a possibility that this could manifest in the child as something like a hyperactive disorder. So I believe that is the reason for it during the pregnancy period. After that, if we look at what happens after our child is born, as I mentioned, children who consume more of these kinds of flavors, spicy foods, bird's eye chili, or those who like spicy foods, usually have a higher chance of becoming hyperactive. Similarly, sometimes I've noticed that the heads of such children will be extremely hot. The heads of children who have hyperactivity disorder will also be extremely hot. So often when we check, it can sometimes feel like they have a fever. Only on the forehead, what we call the frontal lobe, there will be intense heat just in this area. A concept I sometimes apply to such children is that according to Ayurveda, there is a condition where a fever comes to the child's head and without subsiding remains affecting only the brain. This is referred to as Dategata Jwara. So if a fever does not subside and remains in the head, I have felt that this can be a reason leading to hyperactive disorder. So many times I have observed that when this fever persisting in the brain is treated in children, their hyperactivity itself improves. At the same time, in some people, none of this will be present. There won't be any particular heat in the brain or in the head, but still they will be very hyperactive. So for such individuals, as we know, there are certain neurotransmitters in the brain that help prevent this kind of activity or hyperactivity, neurotransmitters like norepinephrine or dopamine. Deficiencies in these neurotransmitters can contribute to the development of such conditions. So in such patients, the medications we give are aimed at correcting dopamine secretion and similar imbalances. Similarly, it is also crucial to consider another significant factor, which is that sometimes children may not be naturally hyperactive. Instead, it could be due to their underlying stress, nikira, or the internal psychological struggles and mental conflicts in their lives that eventually manifest as symptoms of this hyperactive disorder or attention deficit. So there are mental states, dietary habits, and issues related to the brain. Similarly, as a fourth aspect, I have often noticed that some gifted kids or children with exceptional brilliance find it difficult to sit with other children. They want to learn quickly and do things quickly. Often, such an environment is not available at home or in schools. So we tend to label such children as hyperactive. One example that always comes to my mind is Nihal Sarin, who is now considered one of the best chess players in the world from India, and he is from Thrissur. He too was once labeled as hyperactive, just like this. Actually, it was because that child was extremely brilliant that he exhibited such hyperactive behavior. Then when his parents, instead of opting for what we call psychotherapy, made him sit in front of a chessboard, and once he found a place to use his brilliance, the child became calm. So I have often felt that many of the children who are labeled as hyperactive are actually extremely brilliant. We are unable to understand that. It is because we fail to recognize a gifted child that people often come to me mistakenly thinking that the child is suffering from some disorder. So this is how it is. Now let's think about what true hyperactivity actually is. What I usually do is I prescribe medicines that reduce the heat in the brain, or rather cool down the brain. When we do that in treatment, we can divide it into 2 types or even 3 types if needed. The child has an anxiety problem. So if it's an older child, by the time the second child is born, he may develop anxiety that can manifest as hyperactivity in him. So in such cases, we give Ayurvedic medicines that reduce their anxiety. The second reason could be a fever that persists in the brain, and when we give medicines to reduce the fever in the head, the child's hyperactivity also decreases. The third reason is deficiencies in their neuronal transmitters or a lack of dopamine. Treatments should be given for that. Usually the bodies of such children will be extremely hot. To reduce that heat, the whole body will be hot. Give medicines that reduce that heat. Now, we have a lot of medicines available to give internally. Now, as we know, we can even categorize plants into two types, those that are hot and those that are not. So, among those, the ones that are not hot, like sandalwood, red sandalwood, lotus, and plants that grow in water, these are generally cooling. By giving such medicines and taking them internally, we can see that hyperactivity reduces to a certain extent. Similarly, if the children are even more extremely hyperactive, what we can do is give them Shirodhara. As we know, Shirodhara can be done with buttermilk, with milk, or with very cooling oils like those infused with vetiver, Ramacham. When we do Shirodhara with these, the child's brain becomes significantly calmer. Accordingly, we can see that their hyperactive behavior can completely change. So a process like Shirodhara, and similarly another method we often use is called Thalapothekil, where we grind lotus and Irati Madaram, mix them into a paste, and apply it all over the shaved head, covering it completely. Similarly, applying cooling oils like the ones I mentioned earlier, which are infused with Ramacham and such, on the head, or else applying 3 or 4 drops on the forehead at night. Perform such procedures. Dunasha, that is applying medicine in the nose. In this way, we can approach this issue using several methods. When we do all these things, we are definitely assured of results. In any case, we will definitely be able to reduce his hyperactive level to some extent. So let's meet again with another piece of information like this. Thank you.